Welcome to Cancer HealthCast, where science is driving hope. I'm your host, Nikki Henderson. Today, we are joined by Dr. Katrina Goddard, who is the Director of the Division of Cancer Control and Population Sciences at the National Cancer Institute. She will talk about the results of a recent study conducted around the major decrease in cancer deaths. She will also discuss the role of AI when it comes to screening for different types of cancer, as well as other initiatives that will help reduce the cancer burden in the U.S. Hello, Katrina, and thanks so much for joining us on the show.
Hi, thanks so much for having me. I'm really glad to be here today.
Great. Well, Katrina, before we get started, I would like to hear a little bit about your role at NCI. And can you also talk a little bit about the overall mission of the Division of Cancer Control and Population Sciences?
Yes, thank you so much for the opportunity to talk about our research and about our division. I direct a division of about 200 scientists, and our mission is to advance science in population sciences and cancer control to reduce the burden of cancer in the United States. And what is cancer control? It's about reducing the burden of cancer in the whole population. So, we conduct discovery research to help understand what contributes to and causes cancer. And we also think about many different kinds of interventions that can reduce the burden of cancer. So you can prevent cancer from occurring in the first place. You can detect cancer earlier at a stage when it might be more treatable.
Mhm.
You can develop and deliver better treatments for cancer that are more effective and less harmful to the patient. And you can improve the experience of cancer and cancer care for patients, their caregivers, and their families to improve their quality of life. And so our division studies ways across all of these different ways that you could go about reducing the burden of cancer. And we manage a portfolio of about 900 grants that go out to researchers all across the nation who are actually conducting this research.
Okay, wow, that is incredible. That is incredible. Thanks so much for sharing that. Well, NCI recently released results from a study on the drop in cancer deaths over the past 4 decades. Can you share more details about the study? What types of cancers were researched and what impact did prevention and screening have on the cancer mortality rate?
Yeah, thanks for asking about our study. I was really excited to be part of the team that published this study. So, we know that mortality or deaths from cancer have been decreasing over time. And we wanted to better understand what is causing this decline to happen. And in the hopes that understanding what happened in the past might help direct us in the future towards better ways of conducting research in order to reduce the burden of cancer. So we looked at changes in cancer deaths from 1975 to 2020, and we looked at five cancer sites: breast cancer, cervical cancer, colorectal cancer, lung cancer, and prostate cancer. We used models to help us understand what contributed to the decline in deaths. Was it because better treatments became available, new screening methods, better ways to prevent cancer? We wanted to quantify how these different kinds of interventions worked together to ultimately result in this decline in cancer over time. We found that there were about 5.94 million deaths that were averted from these five cancers combined from that period from 1975 to 2020. And interestingly, prevention and screening accounted for 8 out of every 10 averted deaths from these cancers. This contribution of prevention and screening and treatment varied by cancer site, but that is the summary over the five types of cancer that 8 out of 10 deaths averted from these cancers were from prevention and screening.
Wow, and that's nearly 6 million. That
Yes.
oh my gosh, that's incredible. That's great news. Wonderful news. Well, Katrina, what is the Cancer Intervention and Surveillance Modeling Network, or CISNET. And can you talk about their involvement in quantifying the cancer deaths that were averted through 2020?
Yeah, so CISNET is a group or network of researchers that we fund through our division, and they are experts in developing the kinds of models that were used in this study. And in fact, they were co investigators on this study, and I was really grateful for the opportunity to work with them. This network started in 2000 and has been working together for the past 25 years to advance the science of statistical modeling and inform cancer research. We use modeling in situations where it's not practical or feasible to conduct research in other ways. So sometimes it might be too expensive, it could take too long to do a study, or it could even be unethical to conduct a certain research study. And modeling can fill in the gaps in our understanding under these kinds of circumstances when we can't get the evidence in any other way. So, CISNET includes a team of researchers for each of the five cancers that we studied, and they have developed and implemented the models that were used in this manuscript to understand the questions that we were trying to address. They extended their existing models to 2020 in order to produce the estimates that we included in our paper.
A lot of people are talking about AI right now, and I wanted to know what role did artificial intelligence play in screening for any of the type of those five cancers that you mentioned that were included in the study?
Yeah, that's a great question. I think there's a lot of interest and excitement in artificial intelligence or AI and how we can use that to better improve our processes for cancer screening.
Mhm.
This study that we reported on was about what happened in the past from 1975 to 2020. So during that time frame, AI did not really have a significant role in how we screen for cancer. But going forward, it might be possible that AI could have a larger role in how we screen for cancer. And one of the things that you can do with AI is be able to detect patterns in large amounts of data. For instance, that you might have data that includes medical records or medical images. And AI could be used to help us look at those large quantities of data and improve how we're able to identify individuals who would benefit from screening, as well as how we review the images and detect the signals in those images that suggest that a cancer precursor or cancer may be present. So, this is still something that we need to study and understand better, but there is potential for AI to have a role in the future.
Okay, perfect. And my next question is similar. And so I understand that AI, other tech tools were not involved in the study, but I wanted to ask you this. Do you anticipate AI or other tech tools in the future that maybe they could be used in the cancer treatments of patients and possibly help raise their or increase their survival rate?
Yes, I think that's something that we continue to explore as part of the research that is funded through our division. And like I said, researchers across the nation are doing this work. There are some newer interventions that are already available to people that were not included in our study, and that includes things like HPV vaccination for cervical cancer or low dose CT screening for lung cancer. And the reason we didn't include those interventions is because there was really fairly little uptake of those interventions during the time frame of our study. However, we know today in 2025, we're already seeing much more use of these interventions. So that is something that still is, we would like to see more widely used. A significant challenge, though, that we are all faced with is making sure that everyone benefits from these advances in cancer prevention, screening, and treatment. And sometimes technology solutions can make that easier, can make the intervention more accessible, or sometimes a technology solution makes it more acceptable to deliver these interventions. An example of that might be self sampling for cervical cancer screening that you might do at home versus going into your doctor for that testing. So there are many different ways that technology may help us to reduce health disparities, but more research is needed to help achieve this goal. And we also learned from our study that changes in social norms, policies, and systems can be powerful interventions. So, thinking more broadly beyond just technology as the solution. And we found that reductions in smoking during the time frame from 1975 to 2020 actually was a major contributing factor to the reduction in cancer mortality. And there were really social norms that changed and policies that went into place that really contributed to that reduction in smoking. So I just would encourage to think more broadly and creatively about the kinds of efforts that we invest in and study to have a maximum impact on reducing the burden of cancer in the US.
Well, Katrina, are there any other future efforts or initiatives that NCI will be exploring to help reduce the overall cancer burden in the US?
Yes, we are continuously looking at new ways to reduce the burden of cancer. And that may include things like new biomarkers to screen for cancer. It could include new treatments. We're also very interested in ways to prevent cancer from occurring in the first place. So, this is an ongoing and extensive effort within our division and across all of the National Cancer Institute to really reduce the burden of cancer and change cancer as we know it.
Before we conclude, I just wanted to know, are there any comments or final remarks that you would like to leave with our audience?
Yeah, thanks so much for asking about our manuscript and how we can learn from what has been done in the past to help us move forward to the future. And I am really excited about the potential for the research that we're conducting today to really make a difference in people's lives going forward. And so we will continue to do this work. So thank you very much for the time today.
Well, you're more than welcome. Katrina, I just want to tell you thank you. Thank you so much for all the work that you're doing and your whole team is doing. And I appreciate you taking out time to share these details about cancer deaths averted study. And those results are very promising. And it just highlights how important prevention and screening really are. So thanks again for your time. And I hope that you have a great afternoon.
Thanks. Thank you very much.
Thanks for listening to Cancer HealthCast, a production of GovCIO Media and Research. To explore our content, visit our website, govciomedia.com. Keep an eye out for new Cancer HealthCast episodes every month. And if you like what you heard, leave us a review on the podcast platform of your choice. Have a topic you want us to discuss? Contact us at newsletter@govcio.com.